All right, hello everybody. My name is Laura. If you don't know, I'm It's That Nurse on TikTok, and I am doing some CNA review strategy, and it's a 7-day review. So the first three videos already have posted on this YouTube channel. So just please check it out. There's questions that we're reviewing, and then also tomorrow there'll be another review video that we'll post. But I wanted to talk about test prep and strategy for your CNA exam, because if you're going to prep to pass, then you have to have a strategy on how you're going to prep to pass it, right? All righty. So just for those who don't know, every so often at our school, we actually get a question about our program being fully online. And it's not. And the reason why our program is not fully online, for those who don't know, our program is Williams Career School of Excellence. That's our school, Williams Career School of Excellence. Check our website. It's WCSE.com, mywcse.com. We have a hybrid program in that aspects of your program can be done online, but the skills portion and clinicals have to be done on site and in person. And this is because the structure of this exam. This exam is both written and skills demonstration. So we want to talk about our goals for this session is to be able to provide strategies and confidence for success, implement as much of this as needed as possible, okay? So some strategies I want to talk about is familiarize yourself with the test format and content. Um, for the state of Texas, we have a Texas Prometric site that actually tells you the different areas you're going to be tested on. Knowing your role as a CNA is key because a lot of your questions are going to be about your scope, right? What should the CNA do in these different scenarios? It's also important to practice your skills. So those who have been a part of our program, they know they have a final. The final requires the skills final requires them to demonstrate all 20 testable skills in the state, because there's 5 of those 20 that's going to be picked and selected randomly for the CNA graduate. So we always tell the students, number one, we give them access to these videos so that they can prep to pass once they're completed our program. And we're hoping that the test strategies, the training that they went through, that they're going to continue to implement that. Creating a study guide is very important. Like, you want to schedule and hold yourself accountable. In nursing school, I always use that example because every day I worked full time at the time of going through this nursing program. I have 2 different nursing licenses, and one of the times I feel like it was both of them, but either way, every day I came home, I would sit on the sofa and I would actually do test questions to test my knowledge. And that is how I prepped for the test. I had a book that was like a guide for the NCLEX, but I didn't really go back to the bigger textbooks, because if you've been a part of nursing school, you'll know it's a whole bunch of them. So creating that study session, or that study schedule rather, to be able to ensure that you're accountable, because you naturally will lose information. Retention decreases after you complete a program. So I recommend highly that you create a study schedule. Hold yourself accountable to it, even if it's 10 minutes, so many days a week. You schedule your own exam, so you'll know what day you're going to be testing. Hold yourself accountable to creating a study schedule. Mnemonics is something that we typically use in the healthcare industry, or in anything healthcare, to help us memorize like big information, or information that's a little bit harder to memorize or know or remember rather. So creating a mnemonic, and a mnemonic, for those who are like, what is that? It's like, let's say that you're trying to remember. Let me see a different example. Let me see. The what order, the beginning steps of your every skill, right? The beginning steps of every skill. So if you have a hard time remembering that, you first of all have to knock, introduce yourself, introduce what you're going to do. Like, hey, Mrs. Smith, my name is Laura, and I'm going to be your CNA today. I'm going to perform what skill? Is that okay? Getting permission, close curtain, wash your hands, gather supplies, right? So those are the beginning steps. So let's say you have a hard time memorizing that. You can create a mnemonic where you create a sentence of some kind to remind you of each of the things you do. So knock, is number one. So you would create a word for K. And actually, I might create a mnemonic for that. That way you can create a sentence, you can create a rhyme, a song, whatever works with your brain. But that's pretty much what a mnemonic is. It's usually a good way to just kind of squeeze information into a sentence. So when like you state the sentence, your brain starts to wake up and say, oh yeah, that's what I need to do, right? So I'm gonna create a mnemonic for the beginning and ending steps. I think that's a great idea, but that's an example of being able to use, how mnemonics can be very, very helpful in prepping for any type of test, especially a national or state exam. So for written exam strategies, you've seen this, and if you've been following our series, you've seen me talk about some of these strategies already. Number one, make sure you read the questions carefully. When I work with students who might be having a hard time with a certain chapter or information, typically it's because they're not reading things carefully. And they're not noting keywords. And keywords, if you look at some of the other videos, you will start to see like what is the best response for the CNA, or what should the CNA do? Like you're looking for something that actually informs you of what is the question wanting you to focus on and wanting you to answer correctly. Also, you want to do a process of elimination. I highly recommend this because it'll allow you to eliminate all of the incorrect answers so that your brain is only focusing on the possible correct answers. So you're not using unnecessary brain space. At least that's my thought, right? If it's obvious that the answers are not certain answers, why am I focusing on them? In your questions, you also want to prioritize safety. So when a question is about a situation that's a safety risk, you want to look for the safest response or the safest answer. Dignity. How are we preserving resident dignity? A question just came to mind. Let's say the question is asking you, are saying something like Mrs. Smith is in the dining room and you notice that she had an accident, right? And an accident, for those who may not know, maybe I'm talking about maybe they urinated, they voided on themselves. Um, what should the best response of the CNA be? I probably didn't say that right, but you get my drift, right? What would be the best response? Let's say A says the CNA should go and tell the resident in front of the other residents at the table that she had an accident. Why would that not be the right answer? Because we're not preserving dignity. Even though it may be obvious to the other residents at the table, we still want to preserve the dignity of this resident because they're adults. There may be in a situation where they're dependent on us at levels of their care, but we don't want to demean who they are as an individual. So that's one response that would be not correct because we're not preserving their dignity. We're making pretty much almost an announcement. Hey, Mrs. Smith, you're wet. Let's go to your room. Like that's incorrect. So my daughter's laughing at me, so I'm laughing. But that's an example like I'm not preserving dignity. What about, let's say that a response would be like, the CNA walks over to the Mrs. Smith and say, "Hey, Mrs. Smith, I need to show you something. Can you come with me for a second?" Right? So I'm not making an announcement that she's wet. They probably will notice when she gets up. That's not the part that they're really talking about. It's our approach, and are we, the CNA, preserving dignity for this person? And then also rights. So you want to think about the patient rights, right? They have a right to choice, to choose. They have a right to refuse care. So looking at the first three chapters of your book, if you're using the Hartman book, it goes over that. So knowing what those rights are, familiarize yourself, personalize them. A lot of times, big information can be overwhelming, but if you make it make sense to you, it makes it a lot smaller and understandable for you. For instance, like all of the rights, when you look at them in the textbook, are rights that I would want to be, reserved, or what is the word I'm looking for? I would want healthcare providers to interact with me with, like they would respect those rights. So a lot of times, if you just personalize it, yeah, that makes sense, right to privacy, right? Because if I was in a healthcare situation, would I want people to know what's going on in my room? You see what I'm saying? So sometimes just putting yourself into the situation will help it make sense. So when you're coming across questions like this, it's like obvious. Scope of practice. So when we talk about scope, I want you to think about what is the CNA legally able to do. And the reason I use the term legally is because we are usually in situations where you may be asked to do things that are not within your scope, or you're in different types of facilities which have different laws that allow you to do certain things, or different states. So if you're a traveling CNA or seeing a caregiver that, have moved around, you might be tempted to be influenced, or you may allow those experiences to influence your thought process concerning your scope, but you really need to understand the scope of practice, or what you are legally allowed to do in the state that you're testing, so that you're not bringing in those experiences. For those who are caregivers, or who are caregivers and have done this for a while, and now you're deciding to add a certification, it's important for you to know what you are allowed to do now that you're working on a certification. And that's something you should have been taught in the program. And it's in your textbook. Your textbook, literally from front to back, is literally informing you of what you can and cannot do. So you always want to make sure you're answering questions that confirm your scope. One question that just came to mind is about dressing changes. And for those who don't know what I mean by dressing, I'm not talking about clothes, but wound care. A CNA cannot do a sterile dressing. So if a question was saying that the resident, verbalize that their wound dressing, needed to be changed, can the CNA do this task? No, because wound care is not within your scope. And I'm not talking to, like, it's not talking about the CNA who has a great nurse that's her favorite nurse that's showing her how to do all of the different wound cares. That's, neither here nor there. That's not why I'm here. But I'm saying, don't allow that to influence you to think, well, oh, I know how to do that because my bestie showed me how to do wound care. That is not within your scope to do wound care. So that's why it's important to just know what is the scope of practice for the CNA in Texas. You don't have time to argue and wrestle with it, right? You're taking a test that's testing you on the laws and what is allowed for you to do. All right, for skill tests, this is the demonstration part. So remember, in the state of Texas, and I believe most of the states, you have to physically demonstrate your skills in front of a proctor. And you would know if this is a part of your state test by your training provider. Your school should be prepping you to be aware of this. So in the state of Texas, we have an online system that is training students for the written part, and students are asking for clinical hours, but they don't realize that there is a skills demonstration part, and you have to know how to do these skills. These skills are not realistic, and when I say realistic, they're not the way that you would perform them typically in a facility. So you do need to understand what is the standard of the testing company in your state. Follow the instructions exactly. So the proctor is typically going to give you instructions. They're going to tell you how things are going to roll in your test. Pay close attention. In the state of Texas, you can ask questions before you get started. You can't ask questions once your test has started. So if you have questions, this would be the time at the very beginning before things begin to ask the proctor. It's important to pay attention to infection control. You should know when to wash your hands. And for those who are in my program, they understand that you have to wash your hands before you get started, right? So this may mean that once you get the list of skills that you tell the proctor, hey, proctor, let's go to the sink, and you fully wash your hands for a minimum 20 seconds. Remember that the clock doesn't start until soap gets on those hands and you get to rubbing them together. It doesn't start when you turn on the water hose. It starts when the soap gets on your hand and you actually start to rub your hand with friction. And you have to do that for a minimum of 20 seconds. You can go above that time, but at least 20 seconds. After that, in the state of Texas, you are able to then now verbalize where appropriate when you should be washing your hands, because you don't have to keep going to the sink after that first time demonstration. It's very important though to wash your hands right, because you're going to be tested on that demonstration throughout, because now you're just saying I would go wash my hands at this time, we would say wash our hands. Knowing what PPE to use, knowing what skills requires gloves or not, because not all of our skills in the state of Texas requires glove use. So knowing that, if you introduce, what I noticed for students in our program, if you introduce more supplies than you need, it trips you up because we've taught you how, when and when not to. So naturally, your memory bank is gonna be like, this is off. So this is why I always tell students to memorize, and we actually require them to do flashcards on their supplies because of that purpose. That way you're not adding things, because even though you may not realize it, you start to note internally like something's off. And it's because you've added supplies that you weren't taught to add. So knowing what is needed is very important. Narrating your actions, that just means verbalize your steps throughout. We tell our students to do this to help them with their tests. And it also helps you like kind of just silence the noise, like silence the worries, the concerns, the proctor, all of the things. So just remember to verbalize what you're doing. I'm turning the resident on her side. Mrs. Smith, turn this way on a count of three. You want to continue to just verbalize these things. Remember to do your body mechanics. And body mechanics could be elevating that bed at waist length. How are you bending down? Are you bending at the knees when you're transferring a resident? Those are some things that are important to be aware of, because it is something that we teach. Critical steps is that providing privacy, safety, and comfort. When you're doing range of motion, for instance, there's a point where you're literally asking the resident, let me know if there's any pain or discomfort, right? So sometimes there's actually a point or points in your skill to be able to acknowledge or address the resident and check in and see how they're feeling. So some sample questions is like thinking about resident rights. Let's say you had a question about the resident refusing to take a bath. Depending upon your options, you always want to think about their choice, because it is a right to refuse. And then, are you offering alternatives? Is that in the selection of the questions? You want to avoid answering a question like this, stating something like, I would, make the resident take a shower, for instance. That would be obviously, don't say that, because you can't force anyone to do anything. They have a right to say no. But how could you also, preserve their dignity? How could you respect their rights? So just pay close attention to the wording and what is it asking? Is it asking about, is the questions options, the answer options, sorry, focused on, should you report this to a nurse? You know what I mean? So sometimes your answer choices can even direct you to understanding what is actually being asked in a question. Another one is safety questions like residents falling, like what to do. You always want to guide them safely to the floor. You're not gonna like prevent the fall per se, because it can become a safety thing for you. So back in the day, we actually learned how to ease someone on the floor. We want to make sure that they didn't hit their head, and then we call for help. So just pay attention to what that question is asking. Is it asking about, again, what do you do if a resident is like is starting to fall in your presence? Then you want to make sure that they are safely guided to the floor. There's a way to do that properly. Even if you don't know that that's a better answer, then just let them fall. So sometimes some of your choices will point you to what is actually being asked, and it'll allow you to be able to pick the right choice. So just some tips before we finish up is to stay calm during your test. You want to focus, right? Take deep breaths throughout. If you're doing a skills test, the reason we tell our students to verbalize is because it honestly focuses you. It causes you to silence the noise, and it just makes you focus on your words. And if you've been practicing your skills, then your body will follow those words. And sometimes you're speaking ahead of your body, but it's coming along. It's like, okay, I should be turning at this point because I'm literally telling the resident I'm turning. So we anticipate hearing you verbalize. You want to practice critical skills thoroughly, and just practice at home. Just because you don't have the supply doesn't mean that you're not able to practice. So this is why we actually require our students to record themselves practicing these skills. When you're talking about like your written tests, answers, and questions, you want to just review them. Review them. One of the things I always tell students is when you are practicing, doing a practice test, go back over and see and ask your question. Why? Ask yourself, why did I get this wrong? Did you overthink it? Did you second guess yourself? Did you not know it? Because even though you may be upset that you got it wrong, asking yourself why is going to inform you of your own test taking process. And that can help you be more successful because if you notice that 5 out of the 10 of the questions you got wrong was because you second guessed, and when your first inkling was the right answer, then you start to tell yourself, okay, just stick to the first answer that I chose. So even the wrong answers can inform you if you ask yourself the right questions on why. Why did I get it wrong? It'll help you be successful. Um, Clarification. So you can't ask for clarification during the skill test. You can only ask questions before you get started. So just remember that if there's something that you just are not sure of because you're going to be in a different environment than your school typically, ask. In the state of Texas, they allow you to familiarize yourself within the room that you're testing. So if you find that, like, for instance, you don't know where the paper for vital signs are, you can ask that question. If you're not sure if you should wash your hands first, they may not answer that fully, but you can ask, like, hey, I just want to make sure I can verbalize after I wash my hands, because that's something that students will say they ask because they feel weird about it. So just remember to ask. During the test, the proctor may respond, but they may not give you the answer you're looking for, because if you're asking an answer that ultimately can help you pass the test, then it's creating a situation where the test integrity is being, it's being interrupted, right? So just take some deep breaths, remember, and practice, practice, practice.